Well, I'm Karen Whitney. I'm a physician assistant. I graduated in 1976 and was board certified in that year. The first half of my career was dedicated to practicing primary care medicine, and then in 1997 I segued into non-surgical cosmetic work. I specialize in treating leg veins, which involves needles and small, precise injections. So injecting Botox and filler was a very natural transition for me. So for the last 19 years, I've specialized in non-surgical cosmetic work, including non-ablative lasers and other device-type treatments, but really enjoying the injectable aspect of that practice. I am trained by Allergan as an ACE injector trainer, so I actually go out to other offices to train them how to inject and spend really a good part of my day, each day, injecting Botox and fillers. As we age, there are many changes that occur in the face, including loss of fat volume, loss of skeletal volume, stretching and weakening of the facial muscles, and creases on the skin due to movement and loss of elasticity. And this illustrates the type of changes we see with aging as the years go by. In the past, the only solution for facial aging was surgery, which helped with some issues but not with others. We're very fortunate now to have a class of products called hyaluronic acid facial fillers. And these fillers are used to plump and restore volume underneath the skin so that the volume we lose under the eyes, in the tear troughs, along the cheek and jawline can be restored with an injection. We use hyaluronic acid fillers the majority of the time. Hyaluronic acid is something that's found in all living creatures, including us, and it holds the moisture in our skin, our joints, our connective tissues. We can purchase hyaluronic acid in gel form and place it underneath the layers of skin or within the layers of skin to lift and plump. We generally use two brands of hyaluronic acid, Juvederm or Restylane. There's Voluma and Silk, so we have several different treatment options available. These products are similar in their composition, but they are put together differently. They have a different molecular structure so that some have more lift, some are softer, some last a little longer, some are better for certain areas of the face. And so during the course of the consult, we decide what we're trying to accomplish and what product would work best. As hyaluronic acid fillers are injected, you do see an immediate lifting and revolumizing effect, although it will tend to settle and normalize itself over the next few days to a week or so. Also, if for some reason we don't like the results we've achieved, it is reversible with a product called hyaluronidase. And I think that's a very comforting thought for both us as an injector as well as the patient. We use these fillers in many areas of the face. We can fill out temples, which lose volume as we age. The tear trough area often loses volume. The cheeks lose volume, and as that fat settles, we get nasolabial folds and marionette lines. All of these areas can be addressed. As the jawline sags, we can restore some volume along the jawline as well as in the lips. So they're very versatile products to use. So if we talk about using fillers in the lips or around the mouth area, there are usually a few different things that we're addressing. One are the vertical lip lines that occur from smoking, drinking through a straw, or just your facial expression as you talk or think or move your mouth. Also, volume loss in the lips is very common. And while we do see women who actually want to change their looks by adding more volume, we see a lot of patients who just recognize some of that volume has been lost and they want to be restored back to a natural, not overfilled state. The other thing is that the corners of the mouth tend to draw down as we age, and we can get a depression here in this area called the oral commissure. So using a variety of different fillers, we can lift the lips, we can restore volume to the upper lip area or to the lips. When we're treating the upper lip area, you can either inject directly into these lines with small vertical injections, or we can use a very small round tip needle and place a few thin lines of filler going horizontally, which have the effect of stuffing a pillow under a wrinkled bedspread. So by putting some volume under that skin that's starting to show loss and wrinkles, we're stretching it just the slightest bit to help smooth those lines. We even sometimes will put a little bit of filler right above or at the junction of the lip and skin, just for the smallest amount of volume. So we can do that without changing the appearance of the upper lip at all, or we can do it in conjunction with a little bit of lip volumization. When we're treating the actual lips for someone who wants to restore volume, the most common technique we use involves a cannula. A cannula is a longer, blunt-tipped needle, and the advantage is that it pokes through the tissue instead of cutting through the tissue, so you're much less likely to develop bruising. We can use cannulas in the nasolabial folds and marionette lines, but also it's very nice for placing filler in the lips. So instead of several needle sticks into the lip itself or making a poke in one or both corners, threading the cannula very slowly and gently through the lip tissue and then injecting as we go forward and come back out. So we're getting a nice even placement of the filler and directing it where we want. With less trauma to the patient, it's much less painful and much less chance for bruising. When we work on the lip area, swelling is fairly common, and it might show up within a few hours before you go to bed that day, or you might wake up with swelling. Usually, it's not anything that difficult to deal with, but it is mildly noticeable. On occasion, someone might swell more. The ways to help prevent swelling would be to ice immediately afterwards, so we'll give you an ice pack. If you're able to ice off and on the rest of that day, that can be very helpful. Avoiding salty foods and sleeping with your head propped up a little bit all help minimize the risk for swelling. The under eye area has always been a very difficult area to address, and our options are surgery, laser, and volumizing fillers. And when we're talking about using fillers under the eye, what we're doing is restoring volume to this tear trough area. As you see in this illustration, often people will get some bags under the eyes, some looser skin, and some shadowing due to the different contours of the eye, the bags, the skin, the cheek. And as we lose bone and fat in this area, we need to replace that volume with filler. So what we do is actually use injectable filler to restore volume under the eye in this area we call the tear trough. We have a technique that usually results in very little bruising and is quite easy on the patient. By locating the proper anatomic site along the edge of the orbital bone, we can place a needle in there and with one stick often fill the whole entire tear trough. Sometimes we will go back and place a little more filler in the outer or inner corner, but the trauma is really minimized and the chance for bruising is really minimized with the technique that we use. After the product is placed, and it does not sting going in, by the way, but after the product is placed, we're going to gently massage it with my finger or my thumb to make sure it feels smooth and is located along that bone, giving the lift right where we want it. It is common to get some swelling under the eye area, and you can tell your friends that you had an allergic reaction or your allergies are bothering you. Usually it is not severe enough to keep you home from work, but you might look a little different for a couple of days. Using ice after we treat you, using ice that evening, and sleeping elevated are all ways to help minimize swelling. And if we just ask your patience, it's going to resolve itself within really 1 or 2 up to 4 days. So for this reason, we don't like to do tear trough filler right before an important event. We like to know that we have some time for it to acclimate. One of the most frequent questions I get about filler is how many syringes will I need? Isn't that a lot? And oh, I don't want to look freaky or unnatural. And filler is all about volume. One of the worst things we can do for a patient is to really undertreat them, because if I don't put enough volume in, you're not going to see really any result, and you're going to feel like you wasted your money or like it didn't work. So sometimes we'll say start out with 2 to 4 syringes, and that can be a surprising number to patients, but it might take that much to really start to see the changes in the lift that we're trying to accomplish. If you look at this diagram, it shows that when we're young, we have facial fat that really keeps us very nice and plump. And part of the aging process is that that fat not only atrophies or shrinks, but it also tends to droop downward. So we have less fat with gravitational pull affecting it. And our goal really with fillers is restoring the appearance of a youthful face, part of which is restoring the fat loss that we've had. It's very, very common that we would start with at least 1 syringe in each cheek, at least 1 syringe under each tear trough, and sometimes 1 syringe in each nasolabial kind of parentheses area. So at that, we're talking about 6 syringes. And in the proper patient selection, that will look completely natural. People will wonder what's different. Maybe she looks good, I can't tell what. Different makeup, different hairstyle. Our goal is to keep the natural look that we all desire, but restore the volume loss gradually for you. So as I'm assessing your face, whether you're 32 or 62 or 72, what I'm looking for is what kind of changes have occurred and how do we reverse them? And are we looking for a surgical or a non-surgical treatment option? And especially in younger years or with a non-surgical treatment option, we might need 5 to 7 fillers, syringes of filler, to gradually get that result we're looking for. And you can have 7 syringes of filler in your face and look quite natural. That's about what I have over the last year and a half. And it's about placement, it's about using the right product, and it's about knowing the look the patient is looking for. Some patients want a more prominent cheek, others just want the gentle restoration of what they used to have. You know, someone might like a fuller lip than they ever had, but many are just trying to keep it like it used to be or closer to what it used to be. So one of the things that you can do is we make recommendations. I like to come up with a treatment plan for patients and tell them my wish list for injecting their face. And then we can talk about where to start with that. But it's very economical if we talk about using 5 or 6 syringes, even if we don't inject it all at one time. There is a discount with our rewards program to purchasing the syringes at one time and then using them as you're comfortable. And that allows us to have product to top off, touch up, enhance, and really fine-tune the work that we're doing. So one of the questions that I receive is, what about a fat transfer? In other words, can't you take a little of what I don't want and put it up here where I do want it? And we can do that, and we do that, but there are some problems that can occur. And one of the biggest things is we can inject a certain volume of fat, but it doesn't always take, meaning that we've restored volume to what we want, but then some of the fat cells don't take, so that the results then are less predictable. And with the hyaluronic acid fillers, we know exactly what we're putting in, we know where we're placing it, so the results are more predictable. Also, with the aging process, fat does become a permanent part of you, and part of our problem is that the fat settles. So while the idea of a permanent filler sounds great, something that lasts 2 years, like Voluma for example, is a very nice product because we can build on it and add to it, and we're not worrying about it settling with gravity. As I'm treating you with your facial filler, one thing that's very different from Botox is that you do get an immediate result. So that as I place filler in your cheeks, I'm going to show you when I've done one cheek or one half of your face so that you can see the difference. Because the product is placed, there's an immediate lifting and volumizing effect. And while you might get a little bit of swelling afterwards, that is just from the treatment, and that swelling will go down. So it's very helpful that we can look and work together as a team as we go along, because patients are fearful of being overfilled. And with your input, my expertise, we can find that right balance of enough product but not too much. So I like working with fillers because it's rewarding, because patients leave already excited and satisfied by their new look. So having said that, the question would be, what can go wrong with my filler? Well, once again, we are using a needle into your skin, and we're working very hard to avoid sticking any blood vessels. But if I do nick or hit a blood vessel, bruising is a possibility. We do use techniques every day to help minimize that risk of bruising, but it is definitely a possibility. If you do bruise, it is going to go away within 5 to 10 days and can almost always be covered with makeup. If you have any questions, of course, we want to hear from you, and we'll typically schedule a follow-up appointment at 2 weeks. Occasionally, we do a little post-treatment massage of your filler just to help smooth it and encourage it to be exactly in the position that we placed it. So follow-up can help address any concerns or worries that you have after your filler. So one of the most common concerns that I'm presented with is the patient says, I'm feeling draggy, I'm feeling droopy, I'm feeling tired, I'm feeling old. And it's because we've lost elasticity, we've lost fat, things are drooping. And with Voluma especially, we can really lift and restore the volume in the face. And what we're doing with Voluma is adding volume into the cheek area. And when you put some volume in the cheek, it gives a lifting effect to the entire face. It minimizes nasolabial folds a bit, marionette lines, and sometimes we can put filler here and not need nearly as much filler down here. Also along the jawline, we can place a little filler to minimize that appearance of sagging.